And welcome back to the show. November has been declared as National Veterans and Military Families Month, and the VNSNY Veterans Programs provides veterans as well as their loved ones with a skilled veteran liaison who actually will assist and guide them with accessing the many benefits and services available through the Veterans Administration. And joining us now to share a little bit more information and give us some details into this program, we are pleased to be joined by the director of the VNSNY Veterans Program, Joseph Vitti. And Joseph, good to have you.
Thank you for having me here today. I appreciate it. Thank you.
Thank you, and thank you for your service as well.
I appreciate that. Thank you so much.
Talk to me a little bit about this, because we talk about November. It is definitely an opportunity for us to really highlight veterans. We know that veterans don't necessarily get the credit, the recognition that they deserve. But one of the challenges I think that veterans have is really after returning back home, after serving, just really being able to make the connection and the reintegration into society. So share with us a little bit about the programs that you have that are really being able to assist veterans.
Sure. So here over at the Visit Nurse Service of New York, we conduct in our veterans program, we conduct a lot of community outreach and assistance for veterans who need home health care in the comfort of their homes, or also for veterans who may be facing end-of-life situations, who are in need of hospice care, that we can help provide hospice in the comfort of their own homes with their family and their friends next to them. And we have a terrific group of clinicians and social workers to assist in that quality and affordable, accessible delivery of care. And within the VNSNY Veterans Program, we have a team of terrific liaisons who I can't say are veterans themselves, or served as civilians working with the Department of Veteran Affairs, or as clinicians at Walter Reed National Military Hospital down in Washington, D.C., who conduct this outreach and this patient advocacy to assist veterans in the communities or wherever they may call home. So we help them navigate an often complex and VA healthcare system so that they can understand and receive their supplemental VA benefits that can coexist with their Medicare, Medicaid, or private insurance benefits, to really maximize their patient experience and help address astronomical healthcare expenses that, unfortunately, healthcare is the #1 reason for bankruptcy in our nation, and not that anyone should have to experience it, but veterans especially who served our country so honorably. So a lot of them really don't realize these benefits that are out there for themselves and their families to help overcome these challenging situations.
Yeah, you say that a lot of them really don't know, and sometimes there's this reluctance really to go ahead and receive services. Why would you, well, can you give us a little insight as to why sometimes veterans have this reluctance in terms of accepting services or partaking?
Yes, great question. I think there's two answers to that question. I think there are common misconceptions. What I often hear is, oh, I'm not eligible. I wasn't a certain rank. I was only a cook in the Army. I dealt with the Pulse Service. I didn't do this. I wasn't Special Forces. I wasn't in combat. And so our team, that those are common misconceptions. You don't, whether you have an honorable discharge and these other certain determinants of where of when you served and everything else. I like to call the VA a historical based healthcare system. That's why we do the outreach to a lot of community based organizations, veteran service organizations such as American Legions and VFWs, for example. We help them overcome these common misconceptions, because VA benefits really do vary from case by case basis. What I may be able to do for one veteran patient is totally different in a multitude of ways for another veteran patient. It has to deal with what era you served in, World War II, Korea, Vietnam, or peacetime. If you are exposed to certain environmental elements such as Agent Orange, that we see, unfortunately, such a number of different presumptive conditions affiliated with that exposure. Atomic bomb radiation exposure, for example, stationed in Japan following the atomic bomb droppings. and all of these have different conditions. So we help puzzle together someone's current their health diagnoses, and if deemed service connected related to their military time, help them navigate those supplemental VA benefits. And even if their conditions are misfortune and have nothing to do with their military experience, that does not mean that there aren't VA healthcare services out there. There are funeral benefits, there are survivor benefits, there are death benefits out there, which is not the most pleasant conversation to have, but very important to have these advanced directives and to help these families so that they're not faced in that very stressful emotional situation. They're not faced with these things. So we also hear another systemic issue, I'll take care of it myself. We're taught in the military to be very strong and selfless people, and it's very hard to ask for help. And we're taught in the military to never leave a fallen comrade. As an Army veteran, that was ingrained in me, and I'm guilty of it myself. It's that much ingrained in us to never leave a fallen comrade. But our mission here is to never leave a fallen comrade in the military and after the military. And that's the principle that we bring here, is that it's okay to ask for help. We're still here to help you. We're here to help you and your family. It's okay to ask for help. And there are a lot of us out there who need help. And there are a lot of us out there who do possess this technical expertise, who are able and willing to help you. And they're right here in our own community here at the Visit Nurse Service of New York.
Well, got to leave it there, Joseph, but thank you so much again. I think a lot of people will now know that, yes, there are some services that are available. And like you said, we are here to help. Thank you for your service before. Thank you for your service during. Thank you for your service right now. And just want to let you know that we really appreciate you, as November is, of course, our Veterans Appreciation Month as well. Thank you so much.
Thank you so much, and happy Veterans Day to everybody out there. Thank you.
All righty. Well, I want to let you know now, if you want more information, please visit their website, VNSNY.org. And then also on the phone, you can give them a call at 646-983-3999. We encourage you to stay connected to us. We've got more show. Open continues coming up right after this.